exercise that we are here doing, the state reporting, is to be repeated in future. The group would appreciate very much to get disaggregated data year by year, how things have changed, because we can only assess whether you have been successful or not if we see the figures on a disaggregated file. And disaggregated meaning that urban, rural, urban poor, urban rich areas, etc. The disaggregation to see how it affects the population. Okay, that was just a comment. Now I come to my second question, which is related to mental health problems generally. You gave us a relatively short answer, but mental health problems are, of course, very big problems in all countries, because there are so many borderline cases, and it's very difficult, and there are not sufficient psychiatrists around, and the chronic psychiatric disorders in Taiwan during 2011 you described. You gave us some facts, figures there, which I didn't understand, but I'm not a medic. My wife is, but I'm not a medic. So you say the number of patients is, the actual ratio of inpatients and outpatients is 3.74. And then if the ratio is calculated by cases, then the ratio becomes 8.82. I'm afraid I don't understand that. You need to explain that to me, what that means. And then you admit that gathering the information on acute psychiatric disorder is currently experiencing difficulties. Could you explain that a little more, and say what kind of difficulties occur? It could be staff problems. It could be the hospitals that are available for inpatients. It could be the monitoring, the doctoral monitoring in outpatients, and to what extent the families are involved, etc., etc. If you could say a little bit more on that. Thank you.
这个也由行政院卫
I'd like to ask DOH to address the questions. In our responses, in 2011, the number of chronic mental patients, in terms of outpatient refers to a patient who comes to the hospital once at least in the last year. So there are about 150,000 people. Then divided by the number of inpatient. So inpatient means that patient who was hospitalized over the past year, and it was 40,000 people. So 150,000 divided by 40,000, it's 3.47. And of course, part of the patients in the outpatients and inpatients are actually overlapped. So within the last year, there are repeated patients who were both inpatients as well as outpatients. So sometimes they were hospitalized, sometimes they were discharged and then come back to the hospital as outpatient. And there were 20,000 people like that. So the reason that we have such a clear number is because we have national health insurance here in Taiwan. So for the mentally challenged patients, we issue them with a card of catastrophic diseases. So with the card, these patients do not need to pay co-payment. So we have a very detailed numbers here. And sometimes further documents are required. So when it comes to data collection, as long as it does not compromise personal privacy, then we could collect information like that. For example, the number of the number of patients with a certain diagnosis. However, data such as, for example, the hospital visits of last year, this is a data that we cannot provide you with, because there is a law of personal information protection that forbids us to provide you with information as such. So this is our response. Thank you.
On the data issue, I mean, from data protection perspective, there's always the possibility, rather than having anonymized things, to have pseudonymized data, which means that only the doctor who actually does the treatment has those data, and then it's encoded. And for the outsiders, it cannot be traced back to the person. Only for the psychiatrist who deals with it, or for medical reasons, if it has to be decoded, and then under very strict data protection law. But I'm sure you have the same system. Do you?
是
Okay.
那么是
Yes. We do have a coding system here in Taiwan. I think it is for statistical purposes. Sometimes public health workers here in Taiwan need to do data analysis, and the data that we provide are anonymous. So we basically black out the names and ID numbers of the patients, but we could then analyze the diseases or the trend of the diseases.
And then one last question on that issue. You say there are 381 medical institutions that can provide outpatient services and 129 institutions that can provide hospitalizations. That sounds pretty good figures, but the hospitalization, does that mean that these mentally psychiatry disorder people are put in regular hospitals, or are there special wards, or are there special clinics? How many psychiatric clinics do you have to deal specifically with psychiatric disorders?
那么这个部分
I think I'd like to ask Section Chief of Medical Institution Management to answer the question. In terms of outpatient, there are 361 clinics that provide outpatient services. These institutions are distributed in 22 cities and counties. In terms of inpatient, all the award of psychiatry are independent awards. So patients are not hospitalized in general area of the hospital. So they are separate, and there are dedicated doctors and nurses to provide psychiatric treatment and services to psychiatric patients. So it provides outpatient service, hospitalization, and there are also psychiatric services provided in communities. So, for example, after the patient receives care and treatment in the clinic, they can actually go to the rehab center in the community to receive rehabilitation.
What you say, and that's good. But coming from a country that also is highly developed, like your country, Germany, we have very long waiting lists to get psychiatric treatment, particularly the outpatient treatment. Are there sufficient doctors available, or is there a ratio, or are there programs to change the situation? If you could just say a little bit on that. And if not today, this would be something in a future report, because the World Health Organization has asked the treaty bodies to really go into this issue, and because mental health problems are so much on the increase and too little is being done. It's sidetracked from the general healthcare provisions. Okay.
是，谢谢委员。
Thank you for your question. I think in Taiwan, we have the mechanism of national health insurance. And we have a very good planning of the provision of healthcare. So whenever you want to see a psychiatrist in Taiwan, you get to see a psychiatrist. There's no such thing as a waiting list. In terms of the arrangement of hospitalization, I think there are 10 beds of psychiatry every 10,000 people. So comparing with the US and Canada, I think it's actually pretty good data, a very good number. So there's no, there's actually pretty sufficient beds available for psychiatric patients. And in terms of the number of psychiatrists, I think I need to look at the data and then provide the data to you. We do have a certain number of psychiatrists every 10,000 people. I'd like to add something here. Germany is one of the countries that are doing very well in terms of social welfare. However, comparing with the health insurance in Germany, the payment system in Taiwan is rather different. For psychiatric treatment, we have actually favorable payment system for patients. So the payment system in Germany for outpatients basically uses a global budget system, which is why you have a longer waiting list. Whereas in Taiwan, our global budget system is different from the global budget system in Germany. Different countries have different ways of doing things. Sometimes our method solves a certain type of problems, but fails to solve another type of problems. In Taiwan, there was a period of time when the establishment of psychiatric departments was actually very fast, because with psychiatric departments, the hospital would be able to entitle to a better compensation from the national health insurance. And also, they also got subsidies from social welfare department as well. So that's the unique part of how we do psychiatric services here in Taiwan. I'd like to add something here. The number of psychiatrists in Taiwan, it's more than 1,300 psychiatrists providing services to 2.3 million people here in Taiwan. And there's no waiting list here.
Very much for the very specific answers that you gave to the questions. In our list of issues number 39, we asked for information on the availability and accessibility of healthcare for persons with disabilities. And of course, what the state party is doing to improve the healthcare situation of these individuals. We referred you to paragraph 233, and you gave a relatively short answer, and you say that, for instance, that the Department of Health is actively promoting the development of local long-term care system in the remote areas. I can imagine that for disabled persons, it is particularly difficult in the rural mountainous regions where the next hospital is quite some way away. What steps are you taking to give them preferential treatment, more than the average population would get, to make the medical services accessible to the disabled persons? And you note that we asked the questions on the disabled because of our general comment number 5, under our covenant, under Article 12. And the CRPD is only spelling out what we had already in our general comment. almost down to the T, it repeats it. So the question is, how do you cope with this problem in the remote areas for people with disabilities? Of course, disabilities is a very wide expression. It could cover physical and mental disabilities, and the provision of hospital care might be quite difficult. If you could kindly answer that question.
Yes, there are two very important factors. One is remote area. The second is disabled people. So in remote areas, when we develop healthcare for people living in remote areas, one of the important concepts is localization. Localization is about medical as well as care. So in remote areas, you can see that the aging problem is even worse than urban areas because the younger generation all relocates to urban areas. So in terms of health care, in every remote area, we have a health stand or health office. And there are also health facilities in each tribe. And also there are 48 mountainous counties and offshore counties, and we have established medical centers or medical facilities here in these counties, and also large medical centers are required to send medical teams to remote areas to provide health services. And this year, we will complete the digitalization of medical records for people living in remote areas, including x-rays, so that they can take x-rays locally and then send the data back to large medical centers for doctors to look at. And then the traveling doctors can then go to the tribes or remote areas to provide health care. So that was medical. In terms of care, we are beginning to set up long-term care spots. At these long-term care spots, we're going to establish 33 spots in the 48 remote areas, and we're going to complete 48 long-term care spots by tomorrow. And we provide care to these people through the long-term care spots. And the service people are basically local people. We train local people to provide local services to these people, and then that's how we do localization of healthcare.
Let me add something regarding to the healthcare for the disabled. And the National Health Insurance, we have a service called Home Care, because the patients might need to do some home care in their houses. So in the process, the National Health Insurance will send the doctor to the patient's house once every 2 months, and to conduct certain examinations. So these patients do not need to go to the hospitals for these services. And we are also working on servicing the elderlies who live alone. We are trying to work with local government, nurses and doctors of local health agencies will go to the patient's house to provide certain services. And some of these funds will be provided by local governments, some will be funded by the National Health Insurance. That is my additional explanation on that. I also like to add something, that they may not be restricted to remote areas. The national health insurance in Taiwan actually, because MOI had the law protecting the rights of the disabled. So for seriously disabled person, the government will subsidize 100% of the insurance cost. So that is the first thing that we have for the physically disabled patients when they go to the hospitals. And usually when they go to major hospitals, for example, they go to the clinics of National Taiwan University hospitals, usually people will pay 360 NT dollars for the clinic, but physically challenged patients will only need to pay $50. So these are the measures that we have taken to support these physically challenged people. Of course, there's still room for improvement. We will try our best to see whether there are any more revisions or improvements that we can make in this area. Thank you.
We are supposed to finish by 5:30, right?
No, we can finish earlier.
We can finish earlier. Yeah. I forgot to ask one important question, because we already touched upon the issue of maternity leave and childcare in the morning session, and I realized that this is a whole new delegation, from the competent authorities. And if I may put my questions again regarding Article 10, especially on childcare. And there was a question raised earlier, how much childcare facilities are available for children, and you gave a straight answer. So from age newborn to up to age 2, the facilities available is 2% for institutional childcare, and home care is about 12%. So altogether, only 13% of children who are in need, is covered, and then that means 87% of the children in that age group will be left to the family. Mostly to mothers, That's why the rate of employment for women is so low for Taiwanese women, and then from age 2 to 5, you have better coverage, it's 85, almost 85, yeah? So 15 or 16% of children in that age, kindergarten age, are not going to be cared. So my question is, how do you try to solve this lack of enough childcare facilities for this toddler age? In your answer, you described that low fertility rate is almost a national security issue. Yeah, so you are struggling with the problem of low fertility rate, which is related to the woman's work employment opportunity, which is again related to the childcare facilities available, as well as women face difficulty when they want to go back to employment, later, raise the children. So First, my question is how to deal with the lack of childcare facilities, and how do you deal with this issue in general so that the families can take better care of children, not relying predominantly upon women only. Yeah? And then one related issue to health issue is because of low fertility rate, the phenomenon is, especially for remote areas, when a woman got pregnant and then needs hospital care in emergency cases or when delivery, the gynecologists are not available because it doesn't, give enough profit. So the hospital gynecologists are closed down. Does it happen in Taiwan also? Because that's what I see in other countries also. And thank you for giving me additional time.
Madam, you have the floor.
好，接下来请您是不是能够试图回答 ？Thank you for your question. As for childcare facilities, we can have our children welfare agency to answer the question. As for the medical resources in remote area, maybe DOH can answer that question. Thank you for your question regarding in 2010, the government actually conducted a survey on female employment rate. Actually, we see that 54.9% of parents are taking care of their children under 5. 33% of these children under 5 were taken care of by their grandparents. 10.47% of the children are taken care of by babysitters, and only less than 10% were taken care of by child care facilities. Usually, so the majority of children under age of 5 were actually taken care of by their parents. Starting from 2008, we have introduced programs to increase the number of babysitters so that more women can have employment opportunities. And the government also granted 3,000 NT dollars of subsidy for parents with the need of child care. And because of the low fertility rate, so in terms of child care, we try to work in two areas. Number one, providing subsidies. Number one, child care subsidy and the subsidy for a babysitter, as I mentioned earlier. And the requirement is that both of the parents will need to be employed. And they are entitled to receive the subsidy if their tax rate is below 20%. And for the child care subsidy, the requirement is that one of the parents need to stay home to take care of the children. Another issue, child care facilities. We encourage private sectors to establish child care centers. As for child care centers, since it is institutional child care facilities, we pay more attention to the infrastructure, safety issues, so the cost is relatively higher. This will be operated by the public sector as well as nonprofit organizations. We hope that we could establish at least 60 of these facilities in the next 3 years. For facilities providing consultation of parents taking care of children under 3, the public operated nursery will be established, and we hope to have at least 60 locations of these facilities in the first stage. In the future, we want every township or village government authority could have one of these facilities. Next, we will have the sorry. I would also like to answer the previous question about the consultation hotline for teenage girls who got pregnant. The consultation hotline was established in 2007. We have received total of 1,300, 1,500, 1,800, and 1,900 calls per year since its establishment. We see a lot of teenage girls in need who have made the calls. The website was established in 2011. We have 31,000 visits for the first year, and last year the number was 29,000 visits. And we match that with teenagers' pregnancy and abortion rate. In 2008, unmarried pregnancy rate has reduced from 3,802 to 3,158 to 2,806, and it will further reduce to less than 2,000 last year. So we do see the positive results. The number has reduced by 80%. So we will continue to provide the service, since only those in need will make the call. So the number of people using these services will be relatively lower.
I'm from DOH. In terms of pregnancy and healthcare provided to pregnant women, indeed, over the past, we realized that the birth rate in Taiwan is dropping. And OBGY doctors are also decreasing due to the decrease of demand. So for remote areas, in 2011, we began to provide them subsidies to gynecologist clinic in remote areas, so that the gynecologists are more willing to provide services in remote areas. So we at least have a gynecologist to be there or to be on site 24/7 to provide a service to every one spot. So that's the subsidy that we provide to gynecologist clinics. And also in terms of national health insurance payment, we also adjust the structure of payment so that gynecologists providing services in remote areas will be able to be insured with minimum or basic payment so as to increase their motivation to work in remote areas. One more thing to add. One is a short-term strategy, the other long-term strategy. Our representative from DOH was talking about a short-term strategy. Actually, in terms of a long-term strategy, if you look at the demographic structure, you'll see that, we can sort of predict what issues will come up in the future. So in 2007 and 2008, we already began to facilitate local people to receive medical education. We provided them some, for example, scholarship. And every year, there are 27 doctors actually receive government subsidies to receive medical education. And they go for example, family medicine, surgery, gynecology, and so on. So these are the dedicated or required specialties that they have to pick after they graduate. And they also have to go back to their hometowns, which are in remote areas, to provide healthcare services. And it is required for them to serve these areas at least for 7 years. And we find that more than 70% of these students actually stayed in their hometowns or remote areas to provide medical services.
The delegation wish to speak? That is not the case. Well, that brings us to the conclusion of this section. But no, it doesn't. It doesn't. I'm pleased. I'm pleased. My colleague, Mrs. Dandan, has another question that she would like to raise.
Yes, I do have a general question to raise, two, in fact. One has to do with, it's really very general, and I'm afraid I'll put maybe the Madam Head of Delegation on the spot. If I asked, because we have been listening to all your achievements and your difficulties, would you mind telling us, in your, you are very much experienced, I would like to know, right now, right at this very moment, what is the proudest achievement of the Taiwan government with regards to Article 10, 11, and 12? B, what is the biggest challenge facing the government at the moment with regards to Article 10, 11, and 12? Now that's question 1A and 1B. I have another question and also a comment. You know, it's been many, many years that I've been with the Committee on Economic, Social, and Cultural Rights, and I have gone through a lot of NGO information and vis-a-vis government information, and some are really cases where the information are close or opposing or conflicting or contradictory. Before I came to Taiwan, I was reading an article and seeing what a robust NGO community Taiwan has. And I always say to myself when I see this that it's a very healthy sign of not only democracy, but of the fundamental freedoms of people are being respected. And then when I arrive here, I see the disparity, in many cases, sometimes very extreme disparity, in the information that we have from the NGOs and from the explanations of government. Not that either the government is lying or the NGOs are lying. In my experience, also working on the ground, it's usually a case where the two sides are not talking or communicating effectively enough. And I wondered, how far does this social service component, because I don't know what to call it, of the government, how far, to what extent are you really talking to NGOs? How far do you go to find out what is the pulse of people on the street? And it's the NGOs that will give you this pulse. I'm afraid there's something terribly imbalanced here, and I'm sure it can be addressed. And what do you think might that solution be, so that there's a closer cooperation between the government and the NGO? Because really the information, some are very extreme, polar opposites in fact. And sometimes I say to myself, if I had to write my conclusions from this information and from the dialogue that we have had, I don't know what position I should take. I am in a quandary, so please help me go through this. Now, these are my general questions, and I'm putting you on the spot, I know. But since we have time, why not? Thank you.
Madam Minister, you have the floor.
Thank you for your questions, and thank you for giving us the time and opportunity to address your questions. In terms of the communication between the public and private sectors, actually it's being a very important goal of the government to facilitate communication with NGOs. We recently have a new cabinet. One of the goals of the new cabinet is to facilitate communication with the people of Taiwan. Of course, we need to refine our method to communicate. We would look at the number of communications and to look at our approaches and to see if we could talk to NGOs and people in ways and terms that the people understand. I think in some cases, for example, the A7 development project we talked about, the project was to sort of reorganize the illegally used agricultural land so that we're able to build social houses to provide houses to middle to lower income households or younger generation. And we need to also provide job opportunities for people to be able to move in. So we also try to introduce factories in the neighborhood to create job opportunities. But this type of project or development, when we try to communicate with the people of Taiwan, some people may look at it from their, of course, people look at it from their perspectives, taking care of their interests. The projects probably will take away some interest of of some of the people. So I think there's no project that everybody can be happy with. So we can only take care of the interest of the majority. And of course, I very much admit that we need to strengthen our communication with the minority who believes that their interest is compromised in the project. And also in Taiwan, we would like to think about dialogues that facilitate agreement. So that's something that we need to work for. As for Article 10 to Article 12, is there anything that we are proud of? And what the things that are challenging? I think I can only answer the questions from my perspective. Maybe later I can invite my colleagues from DOH or other departments to add as well. One of my colleagues who arrived here, who is the executive secretary from the Office of Global Warming Gas Reduction. So I'm wondering if maybe later he can address some of your questions earlier. And in terms of social welfare and home protection or family protection, to address the challenge of low birth rate, because 2 years ago, our birth rate was 0.895 2 years ago, which was the lowest. So the government has come up with a lot of policies to restructure our demographics to increase birth rate. For example, we would like to create an environment that is friendly to couples, that is friendly to children, that is friendly to parents. So with this in mind, our child policies are being strengthened. For example, we would like to enable the young people to be able to afford houses. So we provide young people with housing programs, for example, subsidies to their mortgages, or if they want to rent an apartment and they don't have enough money, we also have subsidies to their rent. And also we encourage young people to get married. We're trying to create a culture or environment that is pro-marriage, that is pro-children. And also that is why the government has come up with subsidies to childcare. And also we try to reduce the income tax of parents who have children under the age of 5. Our goal is to enable young people to get married and to afford, to be able to afford children. We also are strengthening our public childcare facilities, and we have come up with measures of maternity leave, and we have encouraged private enterprises to set up childcare facilities in the offices. So these are the things that the government has been doing so far to boost birth rate. So last year and the year before, we have seen a very good result. For example, this year the birth rate is 1.2%. So I think that's something that we are the most proud of. Maybe one of the things that we're proud of. But maybe other colleagues may have something to add. Yes, you asked about things that we are proud of. There are two things that I would like to talk about here.
One, okay. In public health field, universal health coverage is our proud. But we have a lot of challenge to overcome, to be overcome.
Could you just name one key challenge that you still have to overcome?
Please advise her to talk to the microphone, please. I think the biggest challenge is premium collection and the fairness of premium collection. We're recently having a reform of healthcare, but it's not ideal. It's less than satisfying, so there's room for us to improve. Secondly, the provision of healthcare needs more efforts. So we need to push our current medical care to pre-health promotion.
With regard to climate change or reduction of gas emission, do you need any supplementary explanation?
What Article 11 is. No, I will. It's the right to housing and the right to food, an adequate standard of living, in other words. And poverty.
Since you pay a lot of attention to housing rights, and the government, during the past 2 years, we have made some amendments of laws. For example, in order to protect the rights of properties, we have made revision to the land expropriation law. Many of the cases we discussed earlier were actually disputes happened before the revision of the law. So now the law has been revised so that we can provide better protection to the people's property. And also, the residence laws has also been enacted. MOI has establish our mid to long-term policies in order to resolve the housing issues for the general public. With these efforts, actually, in terms of the protection of their property and housing rights, we also would like to take care of the underprivileged population in the society who have difficulties in purchasing houses. So we are currently launching a platform. We hope that we can introduce NGOs to have them provide assistance to these underprivileged population to help them find proper housing resources, and the government will provide adequate support and assistance. We are facing some challenges in this area because the housing issue for these people need to be resolved. However, when the government has selected some location to build social housing for these low-income households, the local residents will work against this idea because they think the housing quality or living quality of the neighborhood will be affected, and the housing price will be affected as well. We hope that we can come up with good quality housing for the projects that we are currently under construction right now to set good examples for future projects. We hope that we'll be able to invite young population or underprivileged group to live in this social homes, social houses, and to set a good example. We hope also the NGOs can help us coordinate all these efforts. If we can see some positive results, I believe the local residents will be more rational in responding to these projects.
Thank you. I have another question, which I wanted to ask long ago and forgot, and that relates to the right to water. And in the list of issues number 40, we asked that the reduced rate of water is available for the agricultural sector, and that the fallow land policy began as early as 1973 in the Agricultural Development Act, and what steps the government was taking to secure sufficient access to water. Apparently you have a problem, particularly seasonal problems, that when the water levels are low, too little water comes in, and you need the water for agricultural purposes, particularly for the production of rice, which is very, very water intensive. And at the same time, you need the water for industrial firms. In the times when the water level is reduced, the industrial uses of water are continued. What are you doing about this problem? Thank you.
Thank you for your question. I believe this the Council of Agriculture Affairs should answer the question. Thank you. For the farming water available for the agricultural sector, let me explain. According to local regulation, we have a formula calculating the water available for different purposes. For available use for agricultural purposes, it is calculated based on the area and the losing rate and other factors. So the water available for agricultural purposes has its scientific base or foundation. And as for the priority, agricultural use water rank only second to water for civilians. So during drought, farming agricultural use water, the priority is higher than industrial use water. In the time of drought, industrial use water need to be sustained. If there's insufficiency, then water need to be compensated from somewhere else. We will try to temporarily stop the agricultural activity to provide water for industrial use. MOEA should also respond to this issue. Thank you for your question. And what I want to add is that water in Taiwan, since water for agricultural use is about 70%, 20% is for residential use, and 10% for industrial use. Lack of water in the industrial sector will affect the economy significantly. Only in certain circumstances we will use the agricultural water for industrial purposes. However, we still have some packaging measures. For example, we will try to reduce the use or limited the use of certain purposes to provide the water for residential purpose or industrial purpose. And the loss of the agricultural sector will also be compensated.
A question to that. You've given us the typical answer, good answer, of an economist. And when you talk about policies, programs, and strategies, that one can take as a government policy. That's fine. What do you make of it from the human right to water? Does Taiwan accept that there is a human right to water? And what does it embrace beyond the domestic uses that the committee, in its general comment number 15 on the right to water, did? Because the committee knew that it would be difficult to do the large water questions. But water for domestic purposes is something that is controllable and any country can do, and even a less developed country could do. But for a highly developed country like Taiwan, I would like to know whether you recognize this human right to water as a human right, or whether you just regard it as policy choices like some countries do.
I will try my best to answer the question. In previous cases, most of the water from agricultural purpose will transfer to domestic use. So that is the priority compared with industrial use. For industrial use water, it is difficult to separate water supply for domestic use and industrial use, since they are both in the water infrastructure system. In order to fulfill the demand of the general public, we will only stop the supply of water for agricultural purposes as a last result. Thank you.
Thank you very much. That brings me back to you, Madam Minister. You have the last word.
Thank you. As for your question, I would like to add a few things. Water, yes, it is part of the human right issue. I totally agree that the water price is relatively low compared with other countries. And we also hope that the usage efficiency of the general public can be improved. That is something we would like to do. We would like to encourage the people to do. On the other hand, we will also improve on the utilization of the recycled water, which could be used for irrigation or industrial use. And I believe this will help us resolve part of the problem of insufficient water supply. Lastly, we would like to thank you for your comments and your questions. If there is something that we have not yet responded, we will try our best to provide supplementary materials in written form to you. And as for the teenage girl, for example, the marriage or the rise of unregistered coupled, tomorrow morning, the representative will make supplementary presentations. Lastly, I would like to ask my colleague from the Council of Agricultural Affairs to add a few things. Lastly, we'd like to thank you for your comments and guidance. We will try our best to improve the human rights in Taiwan. Thank you.
Good afternoon, ladies and gentlemen. I have a few comments about agricultural use of waters. Basically, in Taiwan, it's for free. So water used for agricultural purposes is for free. It's, I think, very important measure to protect the rights to use water of farmers. And also, it has to be done through association of water resources. In the past, farmers actually had to pay for their water use, but since 1994, the government passed a law to subsidize fully the water used by farmers. So I think that shows how important Taiwanese government believes that right to use water by farmers. I'd like to give a concluding remark. Are we going to finish here? If so, maybe all of our colleagues here and are we closing here? Yes? Or okay. I'd like to ask my colleagues to join me in putting our hands together for our committee members. Thank you very much.
Thank you very much for the helpful information that you gave us, and also the passion that some of you had. I'm looking at you, which is makes the dialogue very constructive and helpful. And I would like to say tomorrow we are. I take it that you will not be here because there will be other experts from other departments when we deal with Articles 13 to 15 of the Covenant, education and cultural rights. But we will also deal with Articles 1 to 5 of the Covenant, the general questions, for which there was no time yesterday. We were going to do it today, but we were told that the government departments responsible for that could not come at such short notice. So we will deal with that tomorrow, but we will begin with Articles 13 to 15 and then end up with the general questions at the end. Well, with this, thank you very much from our behalf and
thank you very much for your advice and comments to us. Thank you very much.